I think that once you start to ally yourself with other folks that are like-minded, once you're in this place of wanting to know, wanting to learn, wanting to change, these relationships grow, and and together you can make these changes that start, in your workplace and in these larger structures as we move on. Don't shy away from the discomfort.
Many ways of supporting people through distress in the global south and north are not alternatives to psychiatry, nor have they been set up in resistance to psychiatric ways of knowing. Actually, they're not alternatives. When we describe them as alternatives, we risk keeping psychiatry as the main reference point. Instead, they are just completely different ways of understanding distress, different epistemologies.
Mental health is at the center of what we do, and resilience building as a community and community care. And, because there's always this advocacy of like self-care. Yes, it is really great. And also it's helpful to also question like how much of that is built on like a culture of individualism. What about community care? How can we care for each other, especially within affinity spaces? And especially within like the LGBTQ community, or even like Black and or Indigenous people, or neurodivergent people, or just like how can we care for each other in these little in these overlaps of identity and lived experience?
An artifact of white supremacy in our culture is time, conceptions of time, our rigid expectations of abiding by those time frameworks, and without a critique or sensitivity to not just different conceptions of time, but how time is stolen, right, from folks of color and other marginalized groups in our society.
What we're really saying is we need to really disrupt sort of the organization's normative processes, because that status quo maintains that dominance, maintains that white supremacy. So we need to disrupt that. We need to name it and disrupt it. And then we need to really sort of redistribute power in a way that helps you to get really clear about the kind of results and the kind of outcomes that actually would produce racial equity.
We as humans, right, we don't get that we are actually connected in time and space, right? We don't get that we're actually a human organism because we see ourselves so far apart. These people are over in China, those people are in Iceland, right? Like, we don't understand that we are all a part of one organism called humanity. And when there's a dis-ease happening in one part of humanity, it affects us all.